Thank you so much for joining me. Let's dive right in. Welcome to Speak Menopause. I am joined by two incredible guests today, Dr. Kelly Anderson, who is a family physician in Toronto, although I've read has roots in British Columbia. And she's the medical director for Felix. And a face that you might recognize, Dr. Nathalie Gamache, who is a gynecologist here in British Columbia, and someone who supports her patients and her peers with evidence-based menopause information and education. Welcome to both of you.
Thank you, Shirley.
Thanks for having us.
I want to begin today's conversation with three stats. One is there are over 7 million Canadians right now who do not have a family physician. Two is that there are over 10 million women in Canada right now who are over the age of 40. And a statistic that I quote every single day, it's from the In Her Words study, is that over half of women are leaving their health appointments feeling dismissed or disappointed. And I want those three stats to kind of set the stage for today's conversation. And if you don't mind, I'd love to get your thoughts. What do you think of when I say menopause past, present, and future? Nathalie, I'm going to let you go first because your eyes are lit up like,
Perfect. Aren't they always?
yes.
Shirley, thank you for this. I was once asked when I would stop talking about the Women's Health Initiative, and I said never until I die. So we go back there. Everything was fine before 2002 and that study that could not, should not. And we are still unraveling and demystifying the information. It led to a complete abandonment of the education in medical academic centers and residency to train family physicians and internists and OB-GYN. And here we are today. I will throw you one statistic of mine, and it's that 30% of medical institutions in North America, including Canada, now have any minute on menopause hormone therapy, never mind perimenopause, that is too complicated. So 70% of our trainees graduating as medical students, family physicians, obstetric gynecologists, and so on, have received zero exposure to the world of menopause hormone therapy and the complicated process of perimenopause hormonally. So it leaves an entire void. We've been fighting for this for 23 years, and we bring ourselves to the present where I think that there's a renaissance movement, and we have to thank the social media that gave a voice to women. We are now meeting the second and third generation of these women who basically say, I am not going to go through this like my mother. And so they are rightfully demanding the support that they deserve. And what I see in the future is this explosive world that I'm going to get to witness because I'm not about to retire yet.
That's so optimistic, and I'm so in line. So, Kelly, building on that, the title Speak Menopause actually came to me where I was like imagining this scenario where women show up for their appointments informed with a set of questions or at least an idea of what's on the menu. And the health practitioner on the other side of the call or the desk, whatever it is, speaks the same language. So, what do you think of when I say menopause, past, present, and future? And how is the future of menopause care changing?
I think this brings me to like the brief origin story of why we chose to do menopause at Felix. And I remember, 3-4 years ago, prescribing SSRIs for hot flashes because that's what I was taught in medical school.
Mm.
And then to your point, Nathalie, I started getting targeted with social media ads because I'm in that perimenopause range. And I was trying to like sort out fact from fiction on social media. And I was finding the ads a bit predatory. There were a lot of people advertising supplements. I didn't know what was in them. Compounded hormone therapy. Again, I didn't know what was in it. Companies charging hundreds and hundreds of dollars for visits with practitioner. And I am a physician and I couldn't figure it out. Like I'm like, what is going on here? And I had 1 hour of menopause training in medical school. And so I went to Felix, and we offer sort of convenient everyday health visits with practitioners. And I said, this is a complete void. I checked into the wait times around me for menopause clinics. They were like 18 months downtown Toronto. I would send off referrals, and like they would just come back like, can't see, too busy, can't see, like and so the executive of Felix was so, I have said this in every interview, but they threw themselves behind it, unlike any category we've ever done, really. Um, and now it's sort of our third biggest category, and we're changing women's ability to access, an informed practitioner who's going to give them evidence-based care, follow guidelines, who's going to refer them to in-person care when needed, help them navigate their medication choices, use all Health Canada approved hormone therapy and other non-hormonal therapies, and deliver a prescription to their door and follow up with them, like give them 24/7 access to follow up at, you know, prices that aren't that make it accessible.
Mhm.
And it's just not something that's still available to most women. So I'm really excited to keep providing more and more and more access to women who, to your point, lots of them don't even have a family doctor, let alone a family doctor who has had any education in this. So it's so exciting for us to be doing this at Felix.
I think it's really exciting. I love to share anything that's new with the Menopause Chicks community. And I think that, you broke ground in terms of offering menopause care and pharmacy services, where, prior to the pandemic, which feels like a long time ago, but really wasn't in the overall scheme of things, we didn't have that option. So we were taking time off work. We were spending money driving to appointments. We had to talk to a doctor and then a pharmacist, and then we might have gotten mixed information in that. And it just ended up in this whole ball of confusion. So I love to provide clarity, but I also love that Felix is giving us that convenience that we deserve. And I still have a family doctor, right? So I can have a health team that is serving all parts of my health, not just single columns.
Mhm. Yeah, and we're more and more trying to grow our ecosystem to address more health needs. For example, we address weight loss for some of our patients, and what we saw is lots of people needed diabetes care, had diabetes, didn't have family
Mhm.
doctors. And so we went and built a diabetes category because every time we see a need that's not being met, it's really important to us to try to build wraparound online services when we can. For example, we launched a metabolic health category so people could address, not only diabetes, but high cholesterol, like just very preventative care maneuvers that can be hard to access when you don't have a family doctor.
I love that so much because in the consumer conversations, if I say, X number of women have diabetes and don't have a family doctor, it's, oh, that's
Right.
shock and awe, right? Or if I say someone
Yep.
has high cholesterol, they're like, oh, that's terrible. They can't get care. If I say, 10 million women are over the age of 40 and can't access menopause care, sometimes it's kind of met with
Oops.
a, yeah, it's
How
always
inconvenient.
that's how it was for me, or how inconvenient. Yeah. So, I want to use that to pivot to what are some of the top or the most common questions you get asked in your work about menopause?
Oof.
Ooh.
Um, how can we count the ways? I'm still gonna put number one as a little bit of a clarification about the risks of hormone therapy, the association with breast cancer, mostly, even for women who have had just not just, but family history of breast cancer. I think we're still in the business of demystifying the contraindications, both for the population seeking hormone therapy and the ones attempting to provide it. Had a referral a few weeks ago, and I gasped where this 62-year-old was turned down by her family provider for vaginal estrogen because the patient had a family history of heart disease. And I said, this woman is not waiting 22 months to see me. I brought her into the office within 2 weeks. And so she had fear as her personal baggage because she had been told that this was likely not permissible. So a lot of demystification of the contraindication, still dealing with the bioidentical versus compound and the blood testing and the requirement for hormones to balance between the estrogen and the progesterone. And I'm going to land on the amazing page of what about testosterone for myself, right?
Yeah.
So that is now it's been publicized rightfully. Kelly Casperson made it to the FDA panel and had an entire dissertation on testosterone. We now have an international company that has 5 countries approved for a feminine product of testosterone. So the wave is coming, and again, I'm not going to retire until we get this into Canada and that we can finally celebrate doing something that is not off-label, where ovaries produce testosterone in a small amount compared to testicles, but that we all deserve to be considered for if we have the symptoms associated with a deficiency in testosterone and not just libido.
I love that so much because I think we're sitting at this time in history in 2025 where we can be excited that we will all be alive to see these changes happening.
We better be.
I'm not gonna lie, but a decade ago, some of these things felt impossible. They felt
Yeah,
like
totally.
very large mountains to overcome. So
5 years ago. Yeah.
yeah, okay. All right. Thank you for that. Kelly, what are some of the questions that you get asked the most about menopause or menopause care?
Yeah, I would echo that. It's really almost always around the risks of hormone therapy. Breast cancer always being the number one.
Yes.
And it is often having heard something from a different practitioner and coming to us and feeling like they need education or reassurance that it's a safe and appropriate option and why, would be the number one.
Um, I don't know if yeah, I think both of you know this, but I'm a bit of a word nerd. And I remember specifically the first iteration that I read of the North American Menopause Society, as it was called at the time, position statement on hormone therapy. And it only talked about a personalized risk assessment. Everyone needs a personalized risk assessment. So that's what I wrote, that's what I talked about. What women need is a personalized benefit versus risk
Thank you.
assessment.
Thank you.
But the
Yeah,
risks are also
absolutely.
just so low for the
Yes.
vast majority of women, especially in the first 10 years. I think that was my biggest learning working with Nathalie and developing this program is just how many women are eligible for this. And it was certainly, I was not educated in that way in medical school, like, 15 years ago.
Let's speak to that because the clinicians and practitioners who work at Felix have all been the recipient of training from Dr. Gamache and the Menopause Society. So speak to us about your strategy for doing that and what people can expect when they hop on Felix to see if it's a
Mhm.
good fit for them.
So you would go to felix.ca and you can type in menopause or click on the box for menopause. Nathalie and I developed an intake questionnaire where we collect information about the symptoms that you're facing, um, any possible contraindications to menopause hormone therapy, your past medical history, your current medications, allergies, and lifestyle questions about your sleep, your exercise, your diet. And all of that information is kind of synthesized for our practitioners. I think we have about 15 practitioners that work on our platform in the menopause category because there is such extensive training that
Yes.
we've done with those practitioners. So it's a smaller cohort, and the majority of them are Menopause Society certified. And so one of those practitioners, once you submit your visit, would pick up your visit. And it's usually within like 3 minutes that a visit is picked up. We say it could be a few hours, but it's very quick. They'll read your visit, and our visits are done through secure messaging. So you'll hear from your practitioner. They'll be asking you about your symptoms. I worked with Nathalie to create kind of algorithmic recommendations for our practitioner. So it sort of takes the symptoms that the patient's having, any contraindications they have, or preferences about how they want to receive their medication, like pill, patch, ring, like all the different varieties. And then it makes recommendations to our practitioners, like maybe you should think about this. Our practitioners then would have a conversation with you about, what you're hoping for with treatment, give you some suggestions, answer any questions that you have. And then if a prescription's written, you can use any pharmacy you want, or you can use a Felix pharmacy. We ship to your door within 2 days. That secure messaging stays open, so you can talk to your practitioner 24/7 about your treatment and about any side effects you're having, questions you're having. And then at the 3-month mark, you'll be brought back for a follow-up visit. And that's just so we don't lose anyone. Like, we want to know how you're doing. We want to make sure you're not having side effects. We bring everyone back at 3 months. And if you're doing great on therapy, like, we'll send you away with a year prescription and give you advice around preventative care. Like, make sure you get your HPV screening, your mammograms, your routine blood work for diabetes and cholesterol, but we'll just give you your treatment.
That's
And then that still stays open. So patients can come back to talk to us at any point if things are changing. So that's how the visits work.
Yeah, I love that. And that's helped to answer a lot of the questions that I've received too, such as, can I keep my family doctor? Yes, you can.
Absolutely.
Please do.
And we can send a copy of the visit to a family
Sure.
doctor. Yeah, absolutely. Like, we can keep your family doctor abreast. And this doesn't impact their ability to bill. They don't get dinged in any way for you seeing us, which some patients, especially more Ontario-based patients, have worries about that because of the way family doctors are paid. But this does not affect your relationship with your family doctor at all.
Amazing. Amazing. So, Nathalie, the landscape of menopause care is clearly changing. You work as a specialist, as a gynecologist, with a long waiting list. And what advice would you have? I know you can't triage every single, person's menopause care, but what advice would you have for listeners in terms of self-discerning where we should go first or where we might go next?
Um, an attempt definitely with the primary care provider, whether nurse practitioner or family physician, to open the conversation, to send feelers as to where they are and how receptive they're going to be. And if that is an allied relationship, to basically nurture that. I still have too many referrals, unfortunately, where I know the family physician or the nurse practitioner who has gone beyond the call of duty and educated themselves to be ready to receive these patients. And unfortunately, a referral is sent where they're going to be waiting over a year and close to 22 months in my practice, and all of my colleagues are pretty much parked in the same area time-wise, where the referral says, I have offered this patient X, Y, and Z in terms of treatment options, and she prefers to be assessed and have a conversation with a specialist. And I think that we need to be clear that most of the specialists have not received any more than the hour Kelly received as a family physician in their training, even an obstetrics gynecologist. And it's a misnomer to think that the specialist is actually equipped and then they're waiting 2 years. And I can give you examples in my circle regionally here, to speak to someone who says, hey, I don't do this care, I'm going to refer you to the other specialist, and then they wait longer. So if the conversation is, aligning with a physician or a primary care provider, nurse practitioner, who seem to be receptive and knowledgeable, please jump on it, give it a try, and then align yourself. If you have a provider who is not receptive, and this is when I get the referrals that basically say, Mrs. So-and-so demands. I mean, the language is so not subtle, let's say, and you know what the reception was at the other end. And this is when Felix comes into line, right? This is where this service, which is amazing and has been vetted and is solid, is there for women who don't have a physician or don't have a receptive physician or nurse practitioner. Then we need to focus on the education for these physicians.
Yeah. And then for the individuals who have complex health conditions, we can hopefully open up the pipeline to see you. That's a good segue to one of the closing questions I did have for both of you, and that is, are patients showing up more informed or more confused these days?
Ellie?
I would say more confused, and social media is really playing a role in that.
Yeah.
Especially a lot of the social media offering people like bioidentical compounded products and supplements, which is really difficult, I think, for people without a medical education to suss out what's real and what's not. And is why we very specifically only offer Health Canada approved treatments at Felix, most of which are bioidentical but are not compounded. And yeah,
Difficult to
so I
suss
would
out
say,
in 90 seconds. We need to
pardon?
we need to say that when we're talking about social media, difficult to suss out in 90 seconds. If you're making a health
Exactly.
decision based on a meme or a 90-second reel, you are not in the driver's seat of your own health bus yet.
I also just wanted to say that I don't think it's the patient's, I don't think that the onus should fall on the patient to suss out whether trying online care for perimenopause and menopause is correct for them. And like,
Mm,
we help with that. Like if,
right.
so our intake will assess, like, for example, it'll assess your vaginal bleeding. Are you bleeding more than 7 days when you have a period? Are you bleeding more than a pad an hour? Are you having periods more than every 20 days? Are you spotting? Like, we're going to collect that information and advise you if you need to see a doctor in person, why, like what could be going on, what you need to ask when you see a doctor in person. Like, we're going to do that work with humans to, like, I don't think it's the patient shouldn't be the one that's making that decision,
Responsible for, yeah.
like that's our job.
That's a great way to frame it.
Mm-hmm.
Because if you're stewing, if you're ruminating about what you should do next, know that you can get help just
Yeah, just come. We're going to assess for all of those things. Like if you need to see a doctor or a nurse practitioner in person, like we have the mechanisms in place to suss that out and direct you appropriately. Yeah, that's not the job of the patient. That's our job.
Amazing. Natalie, what do you think? Are patients showing up more informed or more confused?
They're showing up assuming they're more informed. I would say probably as of 2 years ago, because of social media, they are very prepared by the time they see me, but there's a bias here, right? So I'm not the front line, I'm the second or third line. They are very aware of their symptoms and the possibility that they're related to perimenopause, and sometimes they've been kind of told that this wasn't, and it was. So very aware and very informed and very well equipped to take on that first visit and carry on. Where they are more confused, and I predicted that a while ago and told you so, is that we are now facing a perimenopausal population where we have even less education, because the concept and the truth of it all is so confusing hormonally. We don't have guidelines, nothing. And they are now being sold by social media things that I do not even understand. They're starting to speak a different language, and they are requesting peptide prescriptions so that their pituitary gland replaces their ovarian function. They're asking for GLP instead of, and it's becoming very murky out there. And I just say, I'm a good old physician with a pen and a prescription pad, and I prescribe hormone therapy to take over a little bit what your ovaries are not doing for you, for symptom relief and also for promotion of health in many cases. And I'm going to end by tweezing something Kelly said that I wanted to reply to. And it's basically that a long, long time ago, I changed the conversation to ask not what are the risks of hormone therapy, but what are the risks of not hormone therapy, both for wellness, which is a direct promoter of health, because when you feel awesome, you tend to your own health, plus all of the health benefits and promotion and prevention of multiple medical conditions that we know we can associate with taking hormone therapy. So let's speak about the benefits of doing it and the risks of not considering hormone therapy when it is appropriate.
That is an excellent soundbite. Thank you so much. I could speak with both of you all day. Thank you very much for taking the time to do this. I will pass the mic back to you for any closing thought. Tell us how we can get a hold of you and anything you would like to leave Menopause Chicks with today. Kelly.
So I mean, for your listeners that don't have access to a family doctor, or access is difficult or conversations are difficult, we would absolutely love to see any of you. It's as easy as going to felix.ca and click on the menopause box or put menopause in the search bar, and it'll take you right into the questionnaire, and you'll meet one of our practitioners, pretty much as soon as you submit your visit. And it's really just been a pleasure to be with you, Shirley. I always like talking with you, and Natalie, you're my hero. And thanks so much for today.
Thank
Thank
you.
you. Thank you.
Natalie, would you like to leave us with a closing thought?
Oh, don't give up. Keep hope up. Do your research and your reading and come equipped to Felix online for the menopause platform, and which I'm so proud to have been a part of. And Kelly, back to you. It's been an absolute pleasure, and always a pleasure to converse with you, Shirley, as well. So proud of all of this, and to have opened the gate for women to have access, as they should, to the care they need in peri and menopause.
Thank you both for speaking menopause with us. Have a great day.
Take care.